So we had a new patient consultation in recently, and this lady made it very clear that she wanted very subtle treatment and the least amount of treatment possible to correct her issues. And she didn't have major issues. I think the main thing from her point of view was the colour. So I think whitening will always feature in all the three options that we eventually came with. But also her front two teeth were a little bit worn on the edges of her teeth. And they were a little bit inset, and you can see from the side view, if I just show you some more, they kind of go in a little bit and the lateral incisors stick out a little bit. Other things that we saw once we had a look inside of her mouth and we took the relevant photos was her enamel was quite weak. She had these superficial craze lines, we call them, little crack lines, and also she showed a little bit of gum and there was some asymmetry. And finally, something that we noticed was, if you have a look at her overall smile, her midline isn't straight, her teeth are kind of tilted down to one side a little bit. So the three options, starting from the simplest, is first is whitening and using some partial coverage, composite bonding just on the edges of her teeth to correct the worn, thinned edges. That is, like I said, the easiest option. However, it won't correct the fact that her enamel is quite thin and she's got the crack lines, her gum line's still a little bit off, and the fact that her midline is off as well. All of these issues will still be there, but like I said, this is the easiest and simplest option and ultimately the cheapest option for the patient. The second option was to carry out two non-invasive veneers on the front two teeth. The reason that this would be a little bit better than just putting composite on the edges of the teeth is it would restore the enamel thinning. It will also add some volume on these front two teeth to kind of get them back into the alignment to mask the fact that they're tipped backwards a little bit. And we could also combine that with a gum lift to correct the gum line, lift the gum up a little bit even to try and restore some of the harmony into a smile. The third and final option is to go down the orthodontic route, where we either use Invisalign or some other form of brace, and what that will do is we will correct the alignment of her teeth. So we'll tip these front teeth out a little bit, we will de-rotate these lateral incisors. There's no need to mask that anymore because we're actually moving the teeth. We'll also try to what we call intrude the front two teeth by pushing them up a little bit, because you can see relative to the back teeth they are quite low down, so pushing them up, although it is a little bit of a difficult movement, is something that we will definitely attempt to do with the Invisalign. And then after the Invisalign, she would still need some whitening, maybe a little bit of bonding on the edges of the teeth. She wouldn't need any non-invasive veneer work at that point, but you know, with Invisalign does involve the need for retention, retainers, and obviously it takes several months to do this as opposed to a couple of days with the other options that we had. Example of a similar case of a previous patient where the central incisors again are a lot further down than the rest of his smile. And what I mean by intruding, if I just press play on this, you can see what we're doing is, as well as correcting the rotations in these teeth, we're actually pushing them up, and we're using the internal anchorage of these back teeth to help with that. So we're correcting the derotations there, and then we're pushing the front teeth up relative to the back teeth to correct the fact that they're further down than the back teeth. So I'll just show you that one again. So you can see how we're pushing these ones up a little bit, and then these ones come down slightly.